Okay, next up will be our friends from KHIE, and we've got Danielle Hughes, who's filling in for Andrew Bledsoe today. Danielle, where are you? There you coming. Okay, so Danielle is with the Kentucky Health Information Exchange, and she's going to give us an update. There have been lots of fun stuff happening, lots of changes happening with KHIE, and she's going to give us an update on all of that stuff. So thank you so much for being with us, Danielle. Let's give her a round warm applause.
Hi, everyone. Thank you for having me here today. Um, Apologies that it's not Andrew. I hope I'll be a decent fill-in. I am Danielle Humes, and I am the transition manager for KHIE project. As many of you in the room know, I know TJ knows, we are in the middle of a transition to our new technology vendor at KHIE. So let me make sure I know how to work this really quick. Thank you. Okay, so here's our fearless leader. But you've got me today. All right. All right, so let's just kick off and talk a little bit about KHIE and what we are all about. So KHIE is the designated public health reporting authority for Kentucky. KHIE, we are connected to all of the acute care hospitals throughout the state, as well as many ambulatory sites and state agencies. KHIE facilitates data exchange of demographics for patients, labs, radiology, immunizations, lots of good stuff that helps with patient care and that coordination. So our new partnership that we're here to talk about today is with KHIE Shared Services, also known as CSS. So if you see that in emails or throughout the presentation, that is KHIE Shared Services. So this is our new vendor. CSS has a modern and flexible technology platform, and we feel like it is going to take KHIE to the next level. So throughout this presentation, you will see some new things that you can expect when using KHIE and different things that you can do with the output that you can get from KHIE. So really using CSS's new, our new platform with CSS is going to help us include public health, social needs, behavioral health data, along with advancing Medicaid claims and health analytics throughout the state. So with changing into this platform, it's really going to sustain KHIE's long-term ability to continue providing free access to this data across the Commonwealth. So a little bit about KHIE Shared Services. KHIE Shared Services, they are a nonprofit provider. You'll see kind of some of the states in a future slide. They have worked with 10 HIEs throughout the country. We feel like they are a very collaborative partner with us. So it's called Shared Services because that's an opportunity that they provide us because we are working with other HIEs throughout the country now. If there is something that, Connecticut is going to implement through their system, then we will be able to kind of have access to that as a shared service into our system. So we really think that's going to take KHIE to the next level. And also we are providing CSS with some of our robust data processes so that we can share throughout the country as well. So we feel like this is sustainable, it's collaborative, and we feel like CSS has been very flexible. So as I'm sure, just like they were speaking about before, public health data reporting does change year from year. So we feel like that flexibility is something that KHIE Shared Services can provide us. So as I talked about, here is a few of the states that KRISP has worked with throughout the country. Kentucky being the latest. So let me talk a little bit about some of the technology and tools and services you can expect for us to have with CHRIS Shared Services. So we'll still be using the Master Patient Index. There'll be a new data lake, which is actually going to help us link data across multiple sources. So that's really going to help with that healthcare and analytics. They have a public health registry infrastructure, so we are heavily focused on, at the moment within our transition, making sure that you all meet those regulatory requirements with your data. So that is one thing that CSS can provide us with. Also, social determinants of health. They have many different tools. So we are currently kind of working on some of those and fleshing out how we can work with Connect and kind of getting all of those resources combined and partner with KHIE on that. There also is a very exciting and a new tool that we'll have. We refer to it as Send. It's the CSS event notification delivery. So some of you all may be familiar with our current service, the event notification, but the Send within CHRIS, when we have that transition, is above and beyond anything that you can get today in KHIE. So we'll talk a little bit about that. We'll also go into depth with a new in-context app. So there are certain EHRs, and really any EHR eventually can work with CSS to where there is actually a portal embedded into your EHR already where you can get access to your KHIE data, which is not available today. So this kind of gives you a little bit of a look of what that in context could look like. So just for an example, we know already from CSS that Athena and Epic clients can have access to this in context app within their current EHR. Again, this is kind of just a preview of what you can expect to see with that with using this within your EHR for those particular EHR systems. Again, the CSS event notification delivery service, this can provide you with real-time alerts for end users, treatment care, relationship management, really whatever your organization could use an event notification for. That is what we are hoping that this CSS event notification delivery service, or SEND, is going to be able to provide. It's also going to be very interactive with the user. So currently, how KHIE works is, we have onboarding analysts that will work with you to kind of determine what event notifications are applicable. We have kind of a standard list. You want admit, discharge, things like that. Within CRISP, we are going to have additional options where you can set up on your own and get kind of more filtered approach to having access and alerts for your clients. So for example, like if there is a pregnancy event notification that you would like so that you can check in with your clients more frequently, that would be something, one of those like interactive, where you can kind of get that filter without just the standard panel that you're used to getting from KHIE. Again, there is also subscription information. So there are going to be care teams set up for particular patients. So that way it's easier on the patient and it's easier on you all to kind of see what that care team is for that patient so that you can collaborate to kind of do the patient coordination that you're used to. So some of the benefits of the new tools that you can expect, again, you see here the custom event notification. Insurance change is another good example of maybe something you want to set up as within that new interactive event notifications. We will be able to do overdose alerting, observation stays. We'll have the full clinical data history, discharge summaries, vaccines, clinical notes, preventative services. We are working on, kind of calling those out, and you all being able to use the data for that mammograms, A1C notification, cancer screenings, things like that. So let's just talk about a few examples that CSS has used in other states throughout the country and how they are using those systems. So, for example, with maternal health, the In Context app delivers up-to-date prenatal data across the care team for someone who is pregnant. That they also have it set up to where you can get a event notification for postpartum care. So another good way to use some of these new tools is, you have a patient, they're pregnant now, you can set up that like postpartum alerting so that as a provider, you want to check in at a certain period and be able to check in on your client for that patient care. Another thing is just the care coordination and surveillance. So we're also going to be providing real-time alerts to local health departments and state-level population health reports for trend monitoring. So if that's something that your organization can benefit from, that is something that the new KHIE Shared Services portal that we'll be using can do for us. Another good, very good positive of CSS is the consent tool that they can provide us. So currently with consent, the patient is responsible if they would like to opt out with their data. They would have to go to each person in their care team and let them know, then let us know so that we can kind of shut down the data and the sharing. With the CSS consent tool, there will be something online to where that patient will be able to log on to our website and provide us that information so that the privacy can be met for that patient. So that is something as a provider, really even as an HIE, is great for us and for you all just to make sure that the patient's privacy is met in the way that they would like. All right, so a little bit more about KHIE Shared Services and their technical expertise. Again, we've talked about the different states that they have worked with. Currently, as of a couple of months ago when I talked with them, 11.5 million clinical event notifications into workflows each month. So we know that the states are using that clinical event notification and that filtering the new tool to the best of their abilities. What you can expect with this transition. So as everyone knows, we love a timeline. Timelines are great, but timelines also do change over time. So we have gone through multiple transitions within KHIE, this being the latest one. And within this, we have shifted a little bit, not to say that the timeline's not going to be met, but we are focusing on public health data at the moment. And again, that takes me back to the previous presenter, just making sure that you are able to meet the regulatory requirements that are needed. So we're here to let you know, do not worry, there will be no lapse in your data feeds, anything like that. We are committed to making this happen and making sure that all data is made it all the way to public health and you have met those requirements. But within the transition, there are some things that will flow into early Q1 of calendar year 26. So we will have all of our participants transitioning. And It will occur in 3 phases. So if you're a provider in the room, you probably know that we've had groups A, B, and C. And we've just kind of done this phased approach because we know that some people have more data and more data types than others. So that's kind of how we have tried to move along with this transition. But there also comes a time like now, everyone has been contacted. We are starting to work with everyone within that like integration process. So that's us contacting you, letting you know we know you have these data feeds. Here is our new partner that we're working with. And here's kind of the documentation we need from you so that we can get these feeds transitioned into our new CHRIS shared services. So within that, we are well into our integration phases. And in some parts, we are with the public health feeds into implementation. So as you can see on the slides here, we will be going into, like I said, early Q1 of calendar year 26. But we are already well into interface development and testing with all groups, with the provider product and tool trainings coming in December. So the integration phases, that's just us completing connectivity intake forms with the providers, developing and testing interfaces with CSS, and then getting any of the transitioning of the platinum services, setting up any new secure connections that are needed with CSS. Within implementation, what you can expect is we will be providing any necessary administrative and technical information. So that's kind of where the training will come in, where we will learn more about the readiness assessment, how we're going to validate the data, and then you will be provided with timelines. And within training, we will have role-based training modules for administrative staff at the providers, technical staff, and end users. This is what is to start in December. All right, I think I left plenty of time for questions today. I hope that we have some.
Here, hang on, let me bring the mic.
Thank you.
Excuse me.
You said Chris was connected to 8 states, so will we be able to pull from those 8 states?
Yes, you will.
That's
Yeah.
awesome.
Yeah, we will have access to a lot more data, and we're still going to be connected with the eHealth Exchange as well within this new. Anyone else? Questions? We do have a booth outside. I will be there. If there are any questions specifically about where you're at in the process, excuse me, or if you have specific questions for your hospital, I'm happy to answer those. I'm so sorry. My email address is danielle.humes@ky.gov. I'm also happy to take any emails if you need any updates. We are working on a webinar to kind of give everyone just kind of an update on where we're at with the transition as well. So that will be coming out next week.
Danielle, you do have one question on the Mentimeter. It says, will CRISP have something similar to Partner Viewer?
Yes, that's a great question. So it's going to be our new KHIE portal is what we're going to be calling it. So yes, and that is the trainings that will start in December about kind of that user and role based that will be able to show you that new portal and how to gain access to that.
Awesome. Thank you. Anything else on the Menti? No.
Any other questions? We appreciate all of your partnership with this. I know that it can be a big undertaking, lots of emails, lots of time spent, but we are committed to making sure that there is no loss of data here and that we continue to be a great partner for you. Thank you.
That's a really big change. So we are so glad to have you here to give us an update. Thank you, Danielle. So